Great Zoom call last night. Wanted to follow that up with a video on what we talked about. One of the cases we talked about was a groin strain, high groin strain, or strain, sprain, pain, whatever the hell you want to call it. All right, so let's look at jumping into there. So a lot of times when the proximal, the close-up hip is giving us grief, a lot of times that's due to some other weaknesses that we see in other parts of the body, especially with individuals that don't do a lot of other strengthening type exercises. So for this, if any of those people that are out there that are sort of the prolonged sitters, right, meaning that our jobs require us to sit for long periods of time, this might be something that could help you out. All right, obviously if anything causes you pain, all right, I want you to stop, reach out to us directly, or reach out to your medical provider. This is not a substitute for medical advice. All right, definitely just some things to try to help some people get through some things that are happening today with everybody. So, easiest way to kind of stimulate that area. All right, so again, if we're talking about this high up groin spot, things that can typically be off, all right, to cause that area to be used a little too much would be core issues, maybe posterior hip or the back side of the hip issues. So that's kind of the approach we're going to take today. All right, so one approach we can take, lacrosse ball, easy way, nice, easy, small circles right around the inside of that area, over the top of where you feel that discomfort. This should be light, guys. Don't make this, we're not trying to irritate anything here. All right, just stimulate that area, stimulate that area, stimulate that area. So if a lacrosse ball is your deal, that's what you're going to work with. All right, nice, easy stimulation right directly over the spot where you feel it. 30 seconds, I'm done with the ball. All right, if you have a stick, all right, rolling stick, rolling pin, we can use that as well. I like this particular one. It's called a grid stick. Also kicks off a little bit of vibration to help out with getting those muscles to relax a little bit quicker. All right. So again, I'm not bearing into this. All right. Light hold, nice easy stimulation, right into that spot, right directly over the area where you're experiencing that discomfort. Keep it light. Keep it light. Remember, guys, we're not square. All right. So we want to start in the middle, do a little bit underneath, grab the back of that hamstring. All right, a little bit on top. All right, again, nice light stimulation. Coming right off of that. All right, first thing we're going to go into is activating or turning on or just making the glutes work a little bit harder for us. Okay, so we'll use this chair, jump on the floor real fast. I have a loop band here. If you have one, go for it. All right, any loop band will work. This particular one's hip halo. Around the legs. We want to make sure we get that entire glute to activate. Laying on our back. Feet should be kind of close together. All right. Knees should be a little bit apart. Head relaxed. Right there in that position. We're going to focus on squeezing the glutes. Back should be in its normal position. Don't curve the back, arch the back, none of that craziness. Whatever's comfortable for you in that position. Band is apart. Right there. Up into that glute squeeze. Really pinching those cheeks as you get up. Thought process on this, guys, is that you're pushing the floor away from that you're pushing down into the floor with your feet, not that you're lifting the hips up. Okay, so right there, boom, I'm sitting position and I'm pushing down into the floor to get my hips to elevate. All right, that would be the hip bridge or the hip thruster, whatever you want to call it. All right, using a loop band. Coming right off of that loop band, we're going to go into a dead bug exercise. So we would do 30 seconds of stimulation to the inside of the leg, 10 to 20 of those hip lifts. In that same position right there, now we're going to have the knees bent 90 degrees, coming on up, pushing on that opposite side, generate some tension. Don't let the head come, not lifting the head up, not reaching, okay? We're bringing the knee to the hand, little pressure. We'll say that's 4 and 4. All right, well, again, just gonna same thing there. We're gonna do that 10 to 20 times. Coming right off that exercise, we're gonna flip right over into a quad position. Hands are directly under the shoulders, knees are directly under the hips. Right there in that position, we're gonna elongate one arm, one leg. Make sure we're kicking that heel straight through the wall behind us, and we're reaching for that wall in front of us. We're not going up, okay? We're reaching out, so we're getting long. Right there, right there. Back should stay flat. We shouldn't see any rolling, any dipping. Okay? And again, that's 3, 3, and we'll take that up to 10, 20 reps. Last one we're going to do, if you have the capability. I've got this punching bag right next to me. All right, so what we're going to do in this position, I know my head's cut off right here, but what we're going to do is a lateral kick. All right, so we're going to strike the bag laterally. If you needed to use a pillow or a couch cushion, absolutely can do that. If you have a bag, great, use that. All right, but we want a sort of a quick little strike there. All right, so it should be kind of fast, should be kind of violent. All right, and just really making sure that we're kicking right out to the side. Again, working on the muscles of the outside of the hip, guys. So, Paul Kowalski, coming to you from the Vallejo Physical Therapy Studios. All right, hope that helps out some of that groin or adductor strain, pain, whatever's happening right up in that area. If any of these activities cause you any pain, guys, remember, don't push through that. Reach out to us directly, and we'll see what we can do for you. All right, have a great one. Thanks. Bye.